Bone and mineral disorder. Disorders of mineralization are two types: rickets that are most commonly occurs in children, and the second one is osteomalacia. Uh, Rickets, a disorder of children that occurring before the physeal closure. Main etiology are vitamin D disorder. There is deficiency of calcium and phosphate, and also renal losses. Calcium and phosphate deficiency due to low intake or rickets of prematurity. Clinical manifestation for rickets are in skull. We saw craniotabes. Cranio means a softening of the skull, um, like parietal occipital bones, frontal bossing, and also there is delayed closures in fontanelles. In chest, we see the ractic rosary, that is painless costochondral prominence. We also seen pectus carinatum, that is prominent of sternum, and third one is Harrison groove, there depression along the attachment of diaphragm at subcostal margin. Then third one is shortening, that is a short stature. Long bones like diaphysis having bowing, metaphysis having splaying or fraying. In knee we see genu varum or genu valgum, or in hip we saw the coxa vera. Also we see muscular weakness. For evaluation of patient, serum calcium phosphate vitamin D is decrease and serum alkaline phosphate is increase. Then we have to give supplemental serum calcium or vitamin D, and also watch for monitoring of response like radiological monitoring, that appearance of white line at metaphysis on X-ray and can be seen within 1.5 month. Then second, metabolic assessment, that is by level of alkaline phosphate. Alkaline phosphate level comes to be normal within 1.5 to 2 years. Initially level of alkaline phosphate are high. When minerals are supplemented, gradually there is a decline in the level of alkaline phosphate. And as the bone is healthy, the level of alkaline phosphate is also normal. Now, second one is osteomalacia. Mainly, osteomalacia is a hunger, also known as hunger or war osteopathy. In that, there is also serum calcium is decreased, that is lack of osteon formation, that leads to compensatory increase in osteoblastic activity, that lead to formation of excess osteoid production. Therefore, osteoid to osteon ratio is more than 1. It mainly occur in female, young female 15 to 40 year. Uh, Patient having backache, proximal neuropathy. Most common site is backache at the spine region. In that also serum calcium phosphate is decreased and serum ALP is increased. And on X-ray in spine we see fish mouth spine, pelvis having a looser zone, pseudo fracture, that is no callus or no displacement, ribble like translucency, that is X-ray hallmark of osteomalacia. Looser zone also seen in osteoimperfecta, renal osteodystrophy, fibrous dysplasia. So how to manage? We give calcium through the milk or green leafy vegetables, or we also give vitamin D, that is non-veg source, like from fish we get vitamin D, non-veg source or sunlight. Now second one is metabolic bone disorder, that is most commonly in the preschool child male. Multiple long bone fracture, pathological fracture is also present. In X-ray, we see the 3D, that is deformities, diaphyseal fracture, different stage of healing. Second one is osteogenesis imperfecta, that is also known as brittle bone disease. How to manage? We give bisphosphonate. Then second one is battered baby syndrome, Caffey's syndrome. In Caffey syndrome, signs of violation is present: X-ray or wrist, avulsion or chips of metaphyseal and of distal radius and ulna, that is also known as corner fracture or bucket fracture. Then third one is Caffey's disease, that is self-limiting disease that occurred in 2-month infant, bone marrow failure and pancytopenia. Now, on X-ray, there is and bone within bone sign, and Erlenmeyer flask deformity. And also we see on X-rays rigor jersey spine. Then fourth one is osteopetrosis or marble bone disease. It is autosomal dominant, or that decrease the functional activity of osteoclast. Then how to manage bone marrow transplantation. The poor this having poor prognosis. Last one is a Paget disease, also known as osteitis deformans, usually seen after viral infection, high turnover disease. In this, axis osteoclastic bone resorption along with axis osteoblastic bone formation. In that, ALP is increased more than 8 to 10 times of normal. And first symptom is back pain, and we can manage by giving the bisphosphonate to a patient. So that's all about the bone and mineral disorders.